want to turn to the kind of messaging again we might hear from the Prime Minister today. We talked about social distancing. Dr. Isaac Bogoch is an infectious disease physician and a clinical investigator at the Toronto General Hospital Research Institute. He's joined us before to provide us with his perspective and insight, and always appreciated. Dr. Bogoch, good to see you again. Thanks for being here.
Yeah, no problem.
Let's start here. Where do you think we are in the course of this pandemic? That's one of the questions I get asked the most is, where are we and what's sort of next? What are your thoughts?
We're still early on. I mean, we're only starting to see the cases climb in Canada. I think we can expect to see cases climb and have a greater number of new cases day after day for at least a week and maybe even longer. It's going to take a while for us to see the fruits of our labor with our physical or social distancing measures that are enacted. So I still think we're early on, unfortunately.
So what do you think controls that? I mean, we talk about flattening the curve or planking the curve, as some people have said. So when we watch this, when you say we're going to see this for at least a week, what sort of factors go into wondering where we are in the curve?
Yeah, it's completely dependent on us. If we truly abide by the Prime Minister's plea yesterday saying, go home and stay home. And if we really, truly physically isolate ourselves from other people, those of us who can work from home, and we don't gather in large crowds, we don't get our kids all together in a playground to play. Like, if we truly spread it out, we can reduce the risk of individuals getting infected, and we can actually reduce transmission in community settings. And this will translate to fewer cases being detected. And then when we're starting to hear these reports day after day, the number of new cases in Canada, we hear this day after day, we're going to start to finally see fewer and fewer new cases reported per day. But that only will happen if we all abide by what we're all supposed to do. And we all know what we're supposed to do. We just have to do it. I think most of us are. There's obviously some high, public examples of people, congregating in large groups, which is completely inappropriate right now. But I think for the most part, we're doing what we're supposed to do.
And what do we know about community spread? I've seen some numbers about that are just staggering, and I think a lot of people don't maybe understand exactly what happens in the process of transmission. You think, gee, I found out I had it, and I remember talking to 3 people, but it was just those 3 people. So that probably isn't a big deal, right? But it is a big deal, right, in terms of how this moves?
Yeah, absolutely. I mean, we know if someone's infected with this virus, close contact with that person, direct contact with that individual can certainly be a risk for getting this infection. And, travel has all but stopped, right? There's very, very few people who are flying into Canada right now relative to like a regular day in Canada. So we're not going to really import many more cases of this. There might be the odd case that's imported, but I mean, like, come on, there's nobody traveling internationally now. And most of these new cases, in fact, almost all of the new cases we're going to be seeing in Canada are going to be locally acquired cases from community transmission. And this is why it is so important to really abide by these public health principles of physical distancing. So some people are supposed to be on this 14-day home isolation because they've recently traveled or they might have had contact with an ill individual. Great. We know what to do. Stay at home for 14 days. For everybody else, who's not on a 14-day home isolation program, you should be social distancing, which means, still stay at home. But also, if you're not staying at home, you should be, if you're going out to get groceries or something, you should make it as minimal as possible and have as little contact with other people as possible.
Right, and it's staggering. You look at least in the early days of the pandemic, this idea of this exponential spread, that people think, I have very few contacts, but it's what happens with those contacts and their contacts, right? I mean, that's staggering.
Yeah. Did you see this stat? There was something like it took 67 days for us to reach the first 100,000 cases. Then it took 11 days for the globe to reach the second 100,000 cases. Then it took 4 days for us to reach the next 100,000 cases. I mean, if that doesn't speak volumes, I don't know what does. Like, this is how we are seeing a global pandemic unfold in real time. And, at least we have some sense of control. We really do. We have some sense of control here in Canada. We can slow it down in Canada. We can mitigate the risk to Canadians. We know what to do. So, here's our time. Let's do it.
How will we know that the social distancing measures are working? And how will we know that the effects of that social distancing can last?
Yeah. So we know the virus has about a 7 to 14-day incubation period. So anything we do now collectively as Canadians, we're not going to see the fruits of our labor for about a 7 to 14-day period of time. So I should really, caution people not to get discouraged when they keep seeing these numbers go up day after day, and they say, well, what's going on? We're social distancing, we're staying at home, we're not in contact with other people. How come we keep seeing these case numbers go up? And even if we all do everything perfectly, we will still see the case numbers go up for a period of time, maybe a few weeks, until the numbers that we see are more reflective of what we're actually doing. So the numbers we see now are reflective of what happened about a week or two ago, and everything we do now is going to be delayed by about a week or two, because that's just how the virus is transmitted, and that's the incubation period of the virus. So I think we have to be a little bit patient to see the fruits of our labor, and then we have to say, okay, let's take a bit of a long-term view here. When can we start to lift some of these social distancing measures? When can we start to lift some of these public health initiatives that are really being imposed on us? And the answer is we need to see a sustained, keyword, sustained reduction in the number of new cases of COVID-19 in Canada on a daily basis. So this has to be sustained over time, and only then will our public health leaders say, okay, you know what, we're going to start to loosen up some measures here. We're a long way away from that. I mean, I really think that the public health initiatives that are really being imposed across the country, I think we're going to have that for a minimum of 2 months, maybe longer. And depending on how our curve appears, and depending on the number of new cases that appear, only then will we start to thinking about reducing some of those measures, and having life sort of maybe return to normal.
It's interesting what you said. Let me drill down on something a little bit there. So when you talk about, okay, we would have to see a steady reduction in the number of cases in Canada. So we would still see perhaps some slight increases, or you want to see no cases being reported across the country for a period of time?
There's not no cases.
Right.
It's just like for example, yesterday we had, I think, over 200 new cases per day. The day before we had over 200 new cases per day. What I'm really referring to is we want to see that those numbers of new cases per day go from 200 to 100 to 50 to 10. Ultimately, we want to get it to 0, but we just want to see this reduction in the number of new cases per day, and we want to see that sustained over time. And if we start to see that sustained over time, we know that we're doing something right.
Are we already seeing second waves in other countries?
I don't know. I think it's too soon to tell. I've been looking very closely at South Korea, at China, at Singapore, at Taiwan, and many of these places are starting to perhaps take the foot off the gas pedal just a little bit. And it looks like Singapore may have it's either a second wave, or they just had an influx of new cases. It's not entirely clear. So there might be. I mean, we have to be prepared for that. If and when, not if, when when there is some reduction in these public health measures, and life slowly starts to return to normal, we have to be prepared that we're going to have a second wave of infection. And the goal is to control that, and to make sure it's not really high and not overwhelming to the healthcare system, and reduce those public health measures in an appropriate manner, so that if we do see a second wave, we're able to manage those quickly.
All right, let's finish on this. A couple of minutes we have left here. So tell me what we're doing really well in terms of governments and actions being taken across the country. And let's start there, and then what's going to follow is tell me where we need to be doing more and we're not doing enough.
So things we're doing well. I think the public health messaging from senior leadership has been extraordinary, and I'm talking about at the federal level. I think at the provincial level, there's been several provinces that have been wonderful with their messaging as well. British Columbia stands out, and as does Alberta. They've had some excellent public health messaging, and certainly our federal leaders have been wonderful. And keep in mind, these are apolitical statements. Like, we just have to give credit where credit's due. I mean, some people have been doing a great job just explaining in real terms what we need to do and why we're doing it. So I think the messaging has been good. I think healthcare is really very provincial, and there are differences in provinces. And I think some provinces have done a good job scaling up the diagnostic testing, and others there's certainly room for improvement.
Okay, and what about, we're hearing lots of questions about testing. People really want to get tested. In some cases, they're being told you don't need to be tested. There's efforts to ramp up testing. Are we where we need to be in terms of testing in this country?
So no, we're not, but we will be very, very shortly. We've had a reduction in the federal regulations in terms of how we can access and test and what tests we can access, and we're going to get flooded with new diagnostic tests, which will be implemented in the day or days ahead. I think we're going to start to see a rapid expansion of diagnostic testing, and many people who have wanted tests will now have access to those tests, and the turnaround time hopefully will be rather short from the time you get tested to the time you get your results back, so you can actually make meaningful clinical and public health decisions. Quebec just ramped this up massively yesterday. I think they tested something like over 500 people yesterday. This is fantastic. Like, this is exactly what needs to be done. They have built that sort of drive-through model in one of their, I think it might have been in Montreal. But like, if we can really expand diagnostic testing, of course, not just with hospitalized people, but with people that just aren't sick enough to be in hospital, so we can get a true meaningful answer and keep people out of hospital if they don't need to be in hospital, we're doing something right. We can preserve our hospital resources for the sickest of the sick, which we know we're going to be seeing more of soon, and then we can care for everyone else appropriately in community settings.
A lot of people want to hear, and this will be my last question for you, they've asked politicians about it. There's a psychology around all of this, as you know, and you've had lots of experience at looking at these around the world. Is it right, and is it, I guess what I'm getting at is, there's something you can say that reassures people about where we are and where we're headed? That I think the next phase for a lot of people is the mental health around this, of distancing and being stuck in a routine they're not used to, and starting to really worry that this is going to be here for a long, long time, and change the way we live for a long, long time. What can you say to reassure those people?
I think there's a few points. One is that, we look at places like China. It's an obvious place. It's where it all started. And, life is slowly returning to normal in China. And this has been about 3.5 months for them. So, they're already starting to lift these restrictions. Life is more than gradually returning to normal, even in the epicenter, even in Hubei province. We heard today that many of these restrictions are being lifted. People are getting back to work. And that took about 3.5 months. We're not China, obviously. We're going to have a uniquely Canadian experience. And, I don't think it's all sunshine and rainbows, sadly. Sadly, every country is going to be affected by this. No one is going to come out of this unscathed. But Canada truly has a robust clinical and public health system. Our healthcare system is strong. We have excellent capacity in this country. We're going to come out bruised and battered just like everyone else, but I think we're going to be less bruised and battered compared to the others. And certainly the Prime Minister discussing these massive stimulus packages for individuals, for small businesses, for travelers. I think this is extraordinarily helpful, just that people can get the support that they need throughout these challenging times. But there is a light at the end of the tunnel. We will get through this. It's going to be a few months, and I think we'll slowly start to regain some sense of normalcy in 2 to 3 more months ahead after all this.
All right, Dr. Isaac Bogoch, always great to talk to you. Thanks for your contribution again today, and we'll talk again soon. Take care.
Be well. You too.